And we are telling you about these new testing sites because right now, Bexar County 19 dashboard, well, it reads that the local risk level of transmission, it is severe. The latest numbers show more than 1,000 people in our local hospitals because of COVID. We're seeing a rise in people testing positive here in Bexar County and across the country. So what does the latest COVID forecast look like? And what does it mean for parents and local families?
So joining us in today's leading essay segment is Dr. Leverance. Thank you so much for joining us. Lots of questions this morning.
Hey, thanks for having me on.
First and foremost, what does the current COVID forecast look like? And do you think that we've peaked right now here in Bexar County?
Well, as we've come to learn, this COVID surges, they tend to be coupled with holidays. So we're not surprised that we're seeing one once again after Christmas and New Year's. So we appear to be peaking out, although we may not quite have reached it yet. So we're still bracing for the worst of it.
So, Dr. Leverance, we are hearing the expression endemic a lot recently. So for those who don't know what that means, and could we be reaching that point after the Omicron variant?
Yeah, that's an important question, and that's where we hope to get to with this pandemic, is to evolve into an endemic situation. That's where you have a low-level activity of an infection in a predictable way, probably similar to how we view the flu, that we can predict that each year we're going to have a surge, we're going to get our vaccinations beforehand, and it doesn't disrupt our lives to the degree that we're seeing with COVID right now.
So the small group of immunocompromised patients who have gotten their booster shots in August, they're due for their fourth shot coming up soon. Now, are these boosters and the opportunity for a fourth shot, is that going to be more widespread than just those who are immunocompromised? And are we going to be having to get these booster shots every 6 months or so?
That's a great question. As you know, for many immunization programs, boosters are a regular part. Again, whether it's the flu shot, which we get annually, which is a type of booster, or the tetanus shot, which you get every 10 years, we suspect the same thing is in store for the COVID vaccination. The frequency of these boosters really unclear at this time. It depends how this all ends up unfolding as we hopefully soon enter into an endemic state. But yeah, I think COVID boosters are certainly in our future.
Dr. Leverance, studies have shown that Omicron, even though extremely contagious, is not as severe, especially in fully vaccinated and boosted individuals. So if other variants form, could they be even less severe like Omicron or pack more of a punch like Delta?
Boy, unfortunately, we have no way to predict, what's coming down the pike with new variants. I know nobody wants to hear that because it leaves us feeling fairly anxious. On the other hand, though, I think the real question is, are we ever going to get over this roller coaster? Are new variants going to be tumbling our way, and are we ever going to get through this? Well, I'm optimistic about it. Clearly, so far, every variant has been susceptible to the vaccines. Also, now we have a real game changer, a 1-2 punch, as you will, and that's the new antivirals, which is sort of like an antibiotic for this COVID virus. And so I feel that we are moving in the right direction. We will eventually get off of this roller coaster. It's just not happening as quick as we'd like.
So I know people have said, COVID will always be around, kind of like the flu or the common cold, but pandemics do end eventually, correct?
They do end eventually. And again, one more time, it's not ending as quick as we would like it to be. There's so many factors at play here. Most of it, I would have to say, is behavioral. Folks getting their vaccines at the beginning of a surge, folks wearing their masks and socially distancing. We in the healthcare profession need to communicate it in better ways, that it's better adopted so people can get into that rhythm and move beyond this. And we're working on that. Again, we're slowly getting there.
One last question for you, Dr. Leverance. We know a lot of families, a lot of parents watching. So what does the risk of transmission look like with schools and small children right now?
I can understand the apprehension for parents sending their children to school in person with this during this current surge, because transmission does occur in the schools. But one thing we have learned is that the transmission rates are not high in schools. And once again, if you think about it, every surge thus far has been coupled with a holiday. Really when the schools have been closed. Most of the transmission is occurring in family circles and in social circles. So I do believe it's safe to have the schools remain open. There's also good data now that closing the schools and having only virtual learning has real consequences on children. And so I do believe it's best to keep the schools open for all of those reasons. Although I can entirely understand somebody's apprehension about it, there still is a low level of transmission which does occur.
Dr. Leverance, we always appreciate your time joining us on Sunday. A lot of people out there have these questions. So for our viewers, if you want to watch Dr. Leverance's full interview, just head to ksat.com later this morning. Thank you.
All right. Thanks for having me.